Hi, my name's Olivia Davies and I'm a junior doctor working at Poole Hospital. This strike is the first one since the new contract has finally been sent out into public. And so what that means is we now can see exactly what the government have been talking about when they've been talking about a safer and a better contract. And what the contract has shown us is that it's not safe, it's not better, and it discriminates specifically against women. Of junior doctors, 60% are women. And that is a fantastic statistic because for years this has been a male-dominated profession and women are starting to now come through. So 60% of your junior doctor workforce are women. The government have put their own contract through their own equality review, and what it specifically states is that this contract is likely to disproportionately discriminate against women. They've justified that by saying that this is a legitimate means of achieving their aim. Their aim is apparently to provide a 7-day service. We already provide that 7-day service without discriminating against women. We're already here 24/7 as junior doctors in the hospital. What the government have managed to get this confused with is a 7-day elective service. The 7-day elective service is something that we would all like to see, but at the moment, with funding not enough for a 5-day elective service, trying to spread that funding over 7 days is going to be detrimental to patient health and safety. Absolutely, and I think you can hear from all of the honking as people go past. People are still absolutely supporting us. People still recognise how important the NHS is and how much of an issue it's become. We're so grateful for all the public support. This has become a fight for our NHS. So although on the surface of it this is just about junior doctor contracts, actually this is a fight for the whole NHS, and I think that the people of Great Britain are rightly proud of our world-class NHS. Yes, I do, and that's what's such a tragedy. People are going abroad, we're losing some of our talent, some of our homegrown, home-trained talent to places like Australia and New Zealand. The rates of application for specialty training are way down this year. It's terrifying to think that come August we're not going to have enough trainees to fill our current posts, and that's something that's only going to get worse with the imposition of this contract. I think that's very difficult to say. I feel that there's lots of things coming to a head at the moment, and I think we as a nation are waking up and taking notice of what's going on, and we're saying actually no, we want to fight for the things that we believe in, and I think that's a really positive thing to come out of all of this. The next strike is the different one. The next strike has been announced as an all-out walkout, so junior doctors from every specialty will be leaving the hospital. That's going to be very, very different. That's something that we do not want to do. We've not wanted to strike at any point, but our hand has been forced by the government. They're not listening to us. They're not listening to the message of 54,000 junior doctors across the country. They're not listening to the message of the nation. They're not listening to the message of the healthcare professionals. The next step is an all-out strike. It's not something we want to do, but it is something that we will plan for, prepare for, and ensure that contingency plans are in place so that there is full consultant cover in the hospital on those strike days. So please, please be reassured that if you are unwell on any strike day, you will still receive excellent healthcare delivered by our consultant colleagues. Jeremy Hunt, I think it's not just you, I think it's your government, and you have been put as the front line. Please listen to what we're saying, please listen to your junior doctors. We're here to support the NHS, we're here to look after everyone in the UK, and we need you to listen to us say that this contract is not safe. Please do not impose it.